Have you ever stopped to wonder how mood disorders can dramatically alter the course of a person's day-to-day life? Each day, millions of people worldwide grapple with conditions like depression or bipolar disorder, conditions that have the power to every aspect of their reality. These disorders can alter perceptions, skew emotions, and even impact the way people relate to one another. These are not fleeting instances of sadness or joy. They are persistent states that can exert a tremendous influence on a person's existence. Tasks that were once deemed simple can suddenly seem like insurmountable mountains. Activities that were once a source of happiness can suddenly lose their charm. Relationships can become strained, careers can be jeopardized, and life can feel like it's spiraling out of control. Amidst this turmoil, science has provided us with effective tools for combating these disorders. Psychotherapeutic management techniques have emerged as the light at the end of the tunnel for many. These methods, rooted in behavioral science, offer strategies for managing and even overcoming these life-changing conditions. But fear not, for there is a beacon of hope in the form of psychotherapeutic management techniques. To understand psychotherapy, think of it as a journey of self-discovery. Picture yourself standing on the edge of an expansive yet unexplored territory. You're filled with a mixture of anticipation, anxiety, and curiosity. You know that the journey ahead will be challenging, perhaps fraught with obstacles and moments of self-doubt. The terrain is a complex labyrinth of emotions, feelings, and thoughts that you have yet to fully comprehend. Now, envision having a trusted guide by your side. This individual is not just an ordinary guide, but a trained mental health professional. They are equipped with the knowledge and skills to navigate the intricate pathways of your mind. They are there to support you, providing a safe and secure environment for you to explore your own psyche. Their role is crucial. They provide direction and clarity, helping you to see things from a different perspective. The journey is long and the seas are stormy, and often you might find yourself lost in the whirlpool of your own emotions. But remember, your guide is always there, helping you to identify the underlying currents, the hidden depths, and the pattern of the waves. They aid you in understanding your feelings, in making sense of your thoughts, and in navigating through the stormy seas of your mind. The first step in this journey involves identifying the mood disorder and understanding its root causes. This is the inception of your voyage, the starting point from which you begin to unravel the mysteries of your mind. It is a crucial part of the journey, as understanding the root cause of your emotional turmoil is key to finding the path towards healing and self-discovery. One common technique applied in psychotherapy is cognitive behavioral therapy, also known as CBT. This therapeutic approach is based on the idea that our thoughts, feelings, and behaviors are all interconnected. To put it simply, the way we think affects the way we feel, and in turn, the way we act. CBT is a unique form of treatment because it actively involves the individual in their own recovery, encouraging them to understand their behaviors and feelings. It's not just about treating the symptoms, but also getting to the root cause of the problem and changing the thought patterns that have led to these issues. The therapy begins by helping individuals identify their negative thought patterns. These are the cognitive distortions that skew our view of ourselves and the world around us. These distortions can range from black and white thinking to overgeneralization, personalization, and catastrophizing. Once these negative patterns are identified, the therapy then focuses on challenging and changing them. This is achieved through a variety of techniques such as cognitive restructuring, exposure therapy, and behavioral activation. The therapy doesn't stop here. The final step is these distortions with healthier, more positive alternatives. This is done by training the individuals to develop a more balanced and realistic view of themselves, their experiences, and the world around them. Imagine having a pair of glasses that only allows you to see the world in a negative light. CBT is like getting a new pair of lenses that allow you to see the world in a more objective, balanced way. Another technique often used is interpersonal therapy, or IPT. Interpersonal therapy is a structured, short-term treatment that typically lasts 16 weeks. It is an introspective journey that effectively enhances your ways of dealing with people and the world around you. IPT is grounded in the belief that regardless of biology or personality, our relationships directly impact our mental health. It uses a unique approach that helps individuals address specific issues in their interactions with others. The therapy sessions are specially designed to help one recognize patterns that may be causing problems in their relations. The goal is to improve the quality of your relationships and social interactions by promoting effective communication skills and emotional intelligence. This process helps in reducing distress and enhancing overall well-being. IPT is a powerful tool that can alleviate the symptoms of various mood disorders. It's like learning a new language, the language of effective communication and emotional expression. Then there's the technique of dialectical behavior therapy, or DBT. This unique therapy method combines two separate approaches to help people handle their emotions more effectively. The first facet is cognitive behavioral techniques. These techniques are based on cognition, or how people think and perceive. They work by helping individuals understand and change thought patterns that lead to harmful actions or emotions. The second facet is mindfulness strategies. Mindfulness is a type of meditation where you focus on being intensely aware of what you're sensing and feeling in the moment, without interpretation or judgment. These strategies aim to help individuals live in the present moment and become more aware of their thoughts, feelings, and actions. By combining these two facets, DBT creates a robust approach to managing emotions. It's not just about understanding emotions, but also being able to control them effectively. It's about creating a balance between accepting and changing behaviors. DBT is often compared to gaining a toolbox of coping mechanisms. Each tool represents a different strategy for dealing with emotional distress. When emotions start to feel overwhelming, you can reach into this toolbox and choose the most appropriate tool for the situation. It's like gaining a toolbox of coping mechanisms that you can use when your emotions start to feel overwhelming. Mindfulness-based cognitive therapy, or MBCT, is another tool in the comprehensive psychotherapeutic arsenal. MBCT, a potent combination of cognitive therapy and mindfulness strategies, is designed to aid people who have previously battled the debilitating impact of depression. The inherent strength of this approach is that it incorporates the tangible benefits of therapy, a form of treatment that helps individuals identify and challenge thought patterns that lead to destructive behaviors and beliefs with mindfulness strategies. What is mindfulness, you might ask? It's essentially about being fully immersed and cognizant of the present moment. It's about accepting our emotions and thoughts without judgment. This acceptance, instead of suppression, helps us gain a healthier perspective of our own thoughts and emotions. When we fuse these two powerful strategies together, a therapy that is highly proactive in preventing relapses in people who have suffered from the darkness of depression. This form of treatment encourages patients to remain rooted in the present, effectively addressing the tendency of their minds to revisit past depressive episodes. The beauty of MBCT lies in the fact that it's not just a reactive solution, but a preventive measure. It's like learning how to stay grounded in the present moment, even when your mind tries to pull you back into past depressive episodes. Now let's summarize. The management of mood disorders is a journey of self-exploration, guided by a skilled mental health expert. Methods such as cognitive behavioral therapy, interpersonal therapy, and mindfulness-based cognitive therapy are beneficial tools. They help individuals navigate their mental landscapes, confront negative thought patterns, enhance personal relationships, regulate emotions, and remain connected to the present. It's a sign of strength, weakness, to seek help for mental health woes. It needs bravery to confront one's mental health struggles and initiate a journey towards wellness. So, if you or someone you know is struggling with a mood disorder, don't hesitate to reach out to a mental health professional. They're there to guide you through the storm and help you find your way back to calmer seas.